Okay. So, thanks for joining. Um, we start our session. So, slides are just containing some contents. It doesn't have much pictures and all that because I was a bit sick, and yes, I excuse myself for that. Um, today the topic is bit also bit more um, needed to be made very clear uh, while we explaining. So it also needs a little bit more clarification because um, some of the terms how we perceive are not the same as chronic fatigue syndrome as we hear. So we just here we what we are going to have in our session is some overview about chronic fatigue syndrome. Well, we will also initially talk about what is fatigue because because every fatigue is not chronic fatigue syndrome. So some of the causes and some of the short descriptions, yes, and prevalence, symptoms, and impacts on life, and Ayurveda as a alternative approach. So, what is fatigue? Fatigue is tiredness, nothing but tiredness. So, tiredness we can feel in various reasons, with various reasons. So, if we don't sleep enough, we will have fatigue. Stress and anxiety, we will get fatigue. Um, Depression, like this is still like more like a disease. So, long time standing depressive feeling, which may include changes in appetite. So you don't feel like eating, or rather, some people eat more. Mood swings, sleep disturbances in depression, and physical inactivity can also cause fatigue. So if you exercise, then only your metabolism goes better, and you have the serotonin and all these neurotransmitters which helps you to feel good, improving the mood and boost energy happens. So physical inactivity also is a reason for fatigue. Dehydration, if you don't drink enough. Nutrient deficiencies. So this is very important. This is really important because first when people comes, this is what if you ask me, if somebody comes to me with fatigue, this is what I think about. I don't think about the chronic fatigue syndrome first. Whether they have enough iron, whether they have enough vitamin D, whether they have vitamin B12, if they are vegetarian, especially if they are vegetarian, vegan, they may have the deficiencies with iron and B12 and folic acid. So this can be this is the very common reason. So balanced diet is very important to have enough nutrients. So nutrient deficiency, before you think about chronic fatigue syndrome and these complicated diagnoses, this is what we need to think about. So now, for example, the season is very cold and dark, and yes, we need vitamin D. So even supplementation helps us to have enough immunity, for example. Anemia, this is the most common in every female. Anemia causes a lot of fatigue. Meanwhile, let's say when you say like diseases, let's say anemia or depression, it doesn't mean that anemia doesn't exist with chronic fatigue syndrome. Means there can be also chronic fatigue syndrome and anemia, but you need to distinguish whether the fatigue is because of anemia or because of chronic fatigue syndrome. So we will also expand on it. Any chronic illnesses, let's say diabetes, thyroid issues and diabetes, autoimmune diseases, this is very common. So these diseases causes diabetes, sorry, the fatigue, and Chronic fatigue syndrome can be exaggerated or rather triggered by these kind of diseases as well. So people may have tendency or they have problems like the chronic fatigue syndrome. We will discuss it in detail. But these diseases are very much how you say, making it um, to happen more um, prominently, let's say. So, thyroid is very common. Diabetes makes people tired because of the up and down of blood sugar levels. Thyroid, the hormone thyroxine, when it is depleted, it causes a lot of disruptions in metabolism. So when we don't have, so thyroxine is that that helps the cells to produce the energy. So cellular metabolism very much depends on thyroxine. That is the same with diabetes. So when the insulin, that which is there in our body from the pancreas, which is secreting, it helps the blood sugar to be used by the cells. So the sugar, if it just floats in the blood and it cannot enter inside uh, inside the cells, or rather it cannot convert it properly to energy. Diabetes is this is the this is pathology in diabetes. Autoimmune diseases, so autoimmune diseases um, causes a lot of fatigue. So that means autoimmune disease means any disease, any our immunity is any disease which where our immunity is attacking our own cells. So we are fighting against ourselves. So our immune system is constantly under the fight. So it may be finding some foreign substances as a kind of threat, and it will start fighting against it without understanding that is not a harmful substance itself. So it may be this may be that's where sometimes when the digestive problems are there, or intestinal issues are there, leaky gut, people say it here now in modern world, leaky gut. So in Ayurveda, this was old times told that ama means undigested or unmetabolized substances which circulate in the blood can result in immune responses, and that can result in any kind of inflammatory response. So we say vata rakta, the blood gets vitiated, and that creates immune response. So this so we know that when our immune system has to fight constantly, then we will the fatigue is resulted. It creates irritation for our brain. The inflammatory substances or inflammatory markers will be elevated, and it will be circulating around. And many of these things, sometimes there is dysregulation in immunity. So we dysregulation means immunity doesn't work sometimes it overworks. So evaluation is very important in this. Sleep disorders, so we told, so the sleep, one day you don't sleep going out for the dinner, it's different from sleep disorders. Sleep apnea means the person doesn't cannot breathe during the night while sleeping. Insomnia, that is a condition itself. Sleeplessness, restless leg syndrome, that's also a nerve related problems, or for the lower limb, legs, which interrupts the sleep, and it may lead to problems. So medications, a number of medications causes fatigue. Even if you take many times paracetamol, you feel like sleepy more. If you have cold or fever, you may take it. So many times this is also. So, and another one, this I have put it in smaller size. So um, chronic fatigue syndrome is one of the reasons for the fatigue. So where we will explain it further. Infections, this is the most common. So this is the most common reason for fatigue. So if I am having a viral fever is viral infections, cold, running nose, influenza, or bacterial infections, various types of bacterial infections. Mononucleosis. This is most common for fatigue syndromes, or because this is a chronic infection, or it can create fatigue. So even the infections which is connected with the gut, like the infections in the gut digestive system, which can also create fatigue, prolonged fatigue, many times. So um, all many of these pathologies have very much connections when we discuss these pathologies are contributory to many of the, as far as what is been understood about the pathology of chronic fatigue syndrome, many of these reasons which we are talking about, the causes of fatigue, many of these pathologies are very relatable, or many of these pathologies triggers the fatigue in chronic fatigue syndrome. So hormonal changes during pregnancy, menopause, hormonal disbalances, sometimes irregular periods also causes a lot of fatigue. Caffeine, when you are having caffeine or alcohol, of course, this disturbs the sleep pattern. This is one of the thing which you can say. It is not only interfering the sleep pattern. It has many effects in the body. So which causes fatigue. For example, caffeine, once you have coffee and then after some time there is a caffeine depletion, caffeine in the blood will go down, so there is a scarcity of caffeine, and then also you feel fatigue. So that caffeine drop down make you also fatigue, feel tired after some hours of coffee consumption. So first you get this elevation and then you get the drop. So environmental factors, so various toxins and extreme weather conditions, this also affects the energy levels. So various toxins, so the air pollutions, here it is still the quality of air is better, or extremities, I mean extreme weather is bit depressive here, but still, yes, energy levels, that causes the depletion in energy level. You feel dark, rainy, you cannot get out, so it's cold, windy. Wind causes also difficulty to get out and walk or feel good, so that you need to stay inside. So weather conditions, so various toxins, yes. So, what we have seen, many of these factors which we talked about, um, fatigue, results in chronic fatigue. I mean, they can be contributory factor for chronic fatigue syndrome. But at the same time, when you try to find solutions for chronic fatigue syndrome, finding the demarcation between what is chronic fatigue syndrome, or plus, for example, anemia and chronic fatigue syndrome, they are coexisting, or thyroid issue and chronic fatigue syndrome is existing together. But this differentiation between the diagnosis is very important. Chronic fatigue syndrome, CFS, is a complex debilitating condition characterized by persistent unexplained fatigue that doesn't improve with rest. This is very important word. Doesn't improve with rest. So that means systemic exertion intolerance disease. So um, there have been many names of names for this CFS. CFS. If you check in internet, you will find many words. For example, myalgic myeloencephalitis. This is more this is the more confused. I mean, when I read, this is the term which more confused me. Myalgic means pain for the muscles. Myeloencephalitis and encephalomyelitis. Encephalo connect with inflammation of the brain. Itis means inflammation. Myelitis means the the nerve, the spinal cord, sorry, spinal cord has inflammation. So inflammation of the brain and the spinal cord exist in this disease of ME. In short, they say ME. But um, rather, most of the chronic fatigue syndrome cases, this inflammation may exist, may not exist. So ME people can have the symptoms, all the symptoms of chronic fatigue syndrome. So people who has myeloencephalitis can have all the symptoms of chronic fatigue syndrome, but the chronic fatigue syndrome people may not have the all the inflammatory problems. Can be, cannot be, may not be, may be there, may not be there. So this is the differentiation. So you need to think about um, here, there, when you read or if you study this, there is always difference of opinion. There is always how you say, studies going on. There is lack of unanimous explanation, or rather um, diagnostic diagnostic criteria even vary from different different systems to different systems. So so this was a problem from the beginning. So but this ME, later termed as chronic fatigue syndrome, in 2015, they termed it as systemic exertion intolerance disease. So this word stands more closer to chronic fatigue syndrome and its symptoms. So people have difficulty to regain the energy. Let's say I'm using a computer or phone. I plug it back so that it gains the charge overnight, for example. The same thing I'm doing every night. I am going to bed and I am regaining the energy. But people who has chronic fatigue syndrome, they say that they are not able to recharge themselves. They have less battery to go through all through the day. When we sleep for 8 hours, we have enough energy to go through the day. Whereas if we sleep for 2 hours, we have less energy. We have less power reserve. So that is what here it happens. The recharging doesn't happen, or rather, they are not able to tolerate the exertion. So symptoms. This is most important. I think everybody think fatigue. That is a symptom of chronic fatigue syndrome. Impaired cognition, concentration, or cognition. You can say cognition and concentration. So here you see myeloencephalitis. So there you have this you can take it as more higher inflammatory condition of chronic fatigue syndrome itself. When there is a high inflammatory response condition is there, there will be more involvement of nerves, brain, or the spine. So there will be more cognitive impairment will be there. So the cognitive impairment, cognitive means what does it mean is like cognition, whatever is connected with cognition means attaining knowledge or perceiving the things. So listening, hearing, understanding, reasoning, everything. So cognition is not working. Or also this word is also correct, impaired concentration. So in severe conditions, cognition is affected. In lighter cases, let's say chronic fatigue syndrome as such, in this baseline, most of the clients who comes, patients who comes, they have impaired concentration, difficulty to focus. They have focus is not good. Muscle pains, so myalgia, disturbed sleep pattern is very disturbed. Post exertional malaise means again tiredness, or rather uncomfort. They say malaise means uncomfort, discomfort, which is very difficult to explain for the client, for the patient. It's very difficult for them to what it is. Am I feeling pain? So that's why people, am I feeling pain, or dull ache, or tiredness? That kind of term is for malaise. many times when because these people cannot explain completely, they are conceived as people who are lazy or people who doesn't want to do things. So they are many times um, undiagnosed or underdiagnosed condition. That's what in medicine they say, underdiagnosed condition. So chronic fatigue is a underdiagnosed condition. um, Many of the doctors say that it is psychosomatic, and they just put it on the side. But modern researchers, recent researchers and developments, they say that there are physiological factors which is resulting in this fatigue syndrome, not only psychological. So diagnosis is very challenging. That's what I mean to say. This is very challenging and it is very difficult. But often, most times, what is happening is the diagnosis is the last diagnosis. All the other criteria, all the other medical conditions which results in fatigue, which I told you in the beginning, are being uh, are being set aside or checked first. First they checked all these, then they, if that all things doesn't um, fit many times, and with all these problems, so fatigue, impaired concentration, muscle pain, disturbed sleep, all these things are there, then they put it in this name of CFS. So CFS is it really impacts the daily life. So very severe conditions I have seen, people, some of the people, they don't even come out of the house, they don't even go out of the house. They say, some of the people, I still remember somebody in Latvia saying that she's very young, she's like 38 or something. She just say that I walk across the street to pick up, bring my um my things like for the food and all. I just went to the shop and came back, and on the way, like crossing the road, she was just stiff, or she was tired, or she just sit down there somehow. So that is the kind of typical example. So these people are scared to go out to even make their minimum things to do. They get severe pain, and they may stay in the bed for very long. They don't want to speak much. They don't like even the response, I mean, to interact sometimes, because they become tired. They can bring some food from the kitchen to the table, and they can get tired. So there are such people also. Some people put it in the name of vegetative dystonia. I mean, these are different things. But yes, chronic fatigue syndrome, I'm saying some of the very extreme cases, this can be also there. So it impacts bedridden. It can also go to bedridden stage. So where there is very severe inflammation for ME conditions, where the pathology is injury to the brain, or severe infections after the trauma, where the real inflammation happened to the brain and spinal cord, they can have these kind of very bedridden kind of situations. And some of the cases is the reason is also unknown. We will discuss about the um, pathology, then you will bit more understand. So 2.5%, up to 2.5% of global population it is affected. Mm, and it is predominantly in people between 40 to 60. It impacts women more, yes. But it can occur in all ages and genders. So common onset, it is mid adulthood, and but onset can occur at any age. So these all has connections with the 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 age and the adulthood. This all has a pathological connection. So many times people who are, for example, early adulthood, when they get this chronic fatigue syndrome, they may have had infections, and then after the infections they get these kind of situations. Or middle age, middle age psychological problems, or rather they say they have crises, or rather hormonal issues or menopausal things. I mean, there can be predisposition, or many of the cases they may have something leading to chronic fatigue syndrome. So uh, differentiating chronic fatigue syndrome from general fatigue. So this is the one thing which I told, we need to understand. Lasting at least 6 months, if the fatigue is lasting for 6 months, severity, the CFS is very debilitating, and fatigue that significantly impairs the daily functioning, then only you can say that it is. Fatigue is not alleviated by the rest and other symptoms also, like post-exertional malaise, unrefreshing sleep, cognitive issues, setting it apart from ordinary fatigue. So this is difference. So when we many of the fatigues are refreshed by these reasons, unless they have some other pathology, like I said about anemia, deprived um, um, lack of nutrients and all these things. So this is the modern perspective about the modern theories about CFS. So current medical theories, they say, means there are a lot to be understood by for about CFS. So different researchers have different opinions, especially about the pathology. So pathology is not completely understood, let's say. But yes, viral triggers. This is the most common. Any kind of infections which leads to chronic fatigue. So no specific virus. Most common is no, most common is mononucleus, mono infection of mono.
Nucleus. Nucleus.
Any problem? Is okay? Everything?
Oui, oui. On va passer le micro. Désolée.
Can you mute?
Sorry.
So here mononucleus, yes, Epstein Barr. Epstein Barr virus, most of 90% of people get Epstein Barr virus by a young age, uh, early adulthood. But but mm, Keshni, can you mute the Natali? I cannot mute her mic.
Ah, ben, I've done it. Ouais, elle n'est pas désactivée le son.
Ah, thank you. Thank you. So that you can speak at home. So viral triggers. So yeah. So mononucleus. Yes. So what happens is many of the people get immunity, and after new researchers, these are the new researchers says that these kind of things. But of course, in practice also, I have seen people who has chronic mononucleosis. I mean, this Epstein Barr, they have very much predisposition to get this chronic fatigue syndrome. So here what happens is many of the okay, mononucleosis happens, and after some years again some other viral infections happens. For example, very classical situation now, what everybody says is, now we had COVID. So post COVID and long COVID has also immune depleting kind of situations, where many of the viral infections which were hidden in the body, they come up. So what happens in these things, they say that the researchers says that many of the viral infections destroys um, the energy producing capacity of these ribosomes and ATP. So in the cells, the energy production capacity is somehow impaired after the viral infections. So energy, how, because these ATP and all these things are there, which micro elements are there, which produces the energy in the cells. So its functions are somehow dysregulated, or it is the fragments are destroyed even by some of the viral infections, they say. So yes, so viral triggers are very very common, and even enteroviruses. So this is one thing we cannot forget. People who has chronic fatigue syndrome, they can have stomach issues or digestive issues. It's not stomach issues, it's intestinal issues. So enteroviruses means that entero means that is connected with the intestine. So when there are some infections which is connected with the intestines, which will lead to pass on to immune system, and which will also um, cause a potential trigger for I mean a reason for CFS. So it can be a trigger, and it can be also the in modern pathological researchers say that this also can be a pathology behind it. um, Both can be there, because a trigger, how it is a trigger, because if you have already a kind of CFS kind of situation, and you get an infection, you get tired, you get more tired, and you get this thing coming up again. Or the infections itself can result in many times in the pathology, they say many of the infections are some of the one of the many of the infections leads to kind of conditions, immunological dysfunction. So in a viral condition, that's what happens. So immune system abnormalities happen. So like dysfunction means immunity works like by regulation, self-regulation. So and also it has a function when some external triggers comes. It produces some of the cells like T cells, cytokinins, and etc. So modern researchers says that mm, these production of these T cells or some particular types of cytokinins are impaired in these people. Neurological factors means abnormalities in central nervous system or dysregulation of neurotransmitters are considered as CFS pathophysiology. So dysregulation of neurotransmitters or neural dysregulation. So let's say we have, for example, HPA axis, hypothalamus, pituitary, adrenal axis. So it means in our brain there is small gland uh, like a bean, let's say size of a bean, and it produces uh, sorry, pituitary is the gland which is there in hypothalamus. So it is hypothalamus is located in the bottom of the brain, and below that there is something called pituitary, which is like the size of the bean. And pituitary gland, so hypothalamus produces stimulates the pituitary gland, and pituitary gland stimulates the adrenal gland. So that's how our fight or flight um, response is mediated. So when we see something or we are under the stress, how to respond some in some adverse conditions. This is by HPA axis. So what happens is every time when there is stress, constant stress. So what happens is it will create a lot of production of cortisol, and um, it will somehow block the productions of it will give the negative feedback for HPA axis. So it will no more um, do the fight or flight response when it, let's say in simple words, it will no more be active. It's like it is flooded with a lot of cortisol. It's no more responding. It's like overdose, let's say. It's not anymore responding. So yes, um, genetic predisposition. Some studies show that genetic component is a contributory reason. So people, parents, or anybody who is having in the family these things, this problem, it can be multifactorial origin with a this is what most of the time people most of the time it is happening. There will be multifactorial origin. So there will be viral trigger. Because of that, there is immune abnormalities. Because of the stress, there is neurological problem, which is also sometimes have genetic predisposition. So multifactorial conditions are most yes. But also, like I said, the common reasons for the chronic fatigue syndromes are also triggers for having chronic fatigue syndrome. So, fatigue, post-exertional malaise, unrefreshing sleep, cognitive impairment. So these are I explained you cognitive impairment. So impaired memory, concentration, whatever the process of knowledge acquaintance is not happening properly. So this is according to IOM criteria, so Institute of Medicine in American um, standard. So we will, yes, 40. Okay, treatments and challenges. So this is the main challenge is because there is a very difficulty to understand or the pathology. There is no specific cure. So every case is different. Every management, most of the time modern doctors focuses on symptomatic relief, or sometimes they just restrict it in treating depression or anxiety. They don't go further down there. Gradual increase in physical activity is often recommended. So they say so management usually is symptomatic in modern science. I'm saying because it doesn't have a standardized protocol because the underlying mechanism is not completely understood. That's why they are not having a protocol. Otherwise there will be a protocol with stamped this is how you need to treat, whether it is post covid or I mean everything, yes, which triggers this or anything. But as fortunately or unfortunately there is no exact reason, I mean protocol. Management focuses on symptomatic relief and gradual increase in physical activity is recommended. So what I was explaining is it is necessary to do some activity even if you have chronic fatigue syndrome, because not overdoing but not underdoing, because you should not lose what energy capacity or metabolism you have. You should not lose it. So it should be every time used in minimum level, and gradually if you are brave enough you can increase it. So um, why you need holistic approach, that is ayurvedic approach in our discussion, is because it is connected to physical, mental and emotional aspects, because they all this disease has its connections in all these aspects. So each individual has unique challenges. So this is where even in ayurveda I cannot give you this is the protocol for everyone, because everybody has unique challenges. So everybody has different constitution and different way of approach. That's where the holistic approach is. Holistic approach is always individualistic, so personalized, patient centered, and more than the symptom management, we go to the reasons more individually, what reasons are causing the problem. So that's why everybody's treatment changes. Some people I will give something to improve your immunity. something to somebody for thyroid, somebody for iron, somebody for, this is how I will approach it. um, Quality of life improvement, so overall well-being improvement, not only physical health but also mental and emotional state, empowers individual to actively participate in their health journey. Many of the people, some of the people are self diagnosing about it. So people, they also pursue, because there is no exact treatment available, they also themselves find the health journey by themselves. So many times the holistic approaches gives this idea. So I don't know I have enough time for introducing about three doshas, but in short, Vata, Pitta, Kapha, it is like Vata is space and air, Pitta is fire and water, and Kapha is water and earth. So when it is space and air, it's more like a movement. Vata is denoted for movement, and nervous system, circulatory system, elimination of the waste, even the childbirth. It is Vata functions. You can see only doshas in functions. You cannot see them in a, how you say, in your hand. You can see only its functions. So these are the functions. When it is balanced, it is very good for enthusiasm, creativity and positivity. So if it is disbalanced, it goes opposite. So many of the symptoms now itself, you can understand, it is the disbalance of Vata. Fire and water, that is what the Pitta is. Pitta is kinetic and potential energy. So you can say it is more like a fire element, where there is which is diluted in water, where there is the metabolism and digestion is, it's one some of the functions. You can see enzymes and hormones which participates in digestion and metabolism is more or less Pitta. Transformation of the food, or even in the brain, whatever ideas are there. So neurotransmitters, let's say, you can attribute to Pitta characteristics, responsible for visual perception, analytical thoughts. So analyzing and discreting, this is Pitta condition. So Pitta is also involved, because you see inflammation is part of, like, heat energy. So you can see, if there is inflammation, definitely Pitta is involved. When it is balanced, it gives a sense of confidence, ambition, decisiveness, everything. Yes, because you can make the decision. So where there is no fog of the brain is clear. It's not airy. Brain is not airy like Vata. When there is Pitta or Kapha, then Vata will not come. When there is emptiness, then the air comes inside. That's how everywhere. When I leave my stomach empty, then the gas comes inside. So if the acid and food is there, then definitely it will not give air element there. So this is how the brain is properly brain has proper function with the neurotransmitters and its processing. Then there is no confusion, there is no fog. Kapha, it is water and earth. So the liquid element and the earth element, water element and earth element. So liquid state of matter, and solid state of matter. So you can understand it more for the anything which is potential energy, or that which stabilizes the body, the matter, as it is the heavy, stable matter. So all the solid substances in the body, so the organs in the body, solid matter of the body, you can attribute to Kapha characteristics, source of immunity, stability. So the mind, when it is stable, it's more attribute of Kapha. So it lubricates the joints, it produces salivary secretion. So there is joint lubrications happening because of the liquidity and the elements of earth. Supports and holds the emotion. So it is more sticky in characters, Kapha. So it is more holding together. So it is more like nurturing, patient, compassionate, loving. So more stable and more holding together characteristics. So they don't leave the things as it is. So Kapha is very essential for immunity. So you can see when there is immune disturbances, you can attribute it to Kapha disbalance. So when there is infections, you can or viral problems. It can you can attribute to pitta vata conditions, but all the doshas can be also disbalanced because immunity also will be disbalanced in later times. If it is mental issues, all the three doshas will be disbalanced, but vata and pitta is more connected. Nerve related problems, vata and pitta is more related. Kapha is also important because it gives the stability. So based on the pathology, you can also put those things in vata pitta kapha terms. But we have also other things like all the three doshas can get involved because eventually everything get involved. Immunity also get improved. Mainly, maybe you can say Vata Pitta, but Kapha also gets involved in later times. Jadarakni. So this is very important. So we always focus on our the digestion. So if any advice we give, we always give something to clean the digestive system, maintain the digestive fire, so that you don't get infections, don't get enteroviruses, for example. Many of CFS patients also have digestive sluggishness. So Agni, or the digestive system protection, is very important. Dhatus. Dhatus means the how you call the tissues, the healthy tissues, let's say, in the body which maintains the body. So Rakta dhatu means the blood tissue. That is involved many times. Rajas and Tamas. This is the among the three gunas of the mind. Three gunas of the mind. So Sattva means the purity, pure consciousness. When there is clarity, Sattva is predominant, we say. Rajas is more about uh, passion, uh, um, doing the things, and more. It also can represent the aggressive characters like anger, frustration, and intensive things. Tamas stands for darkness, more like depressive, staying away, more in a kind of depressed state. So rajas and tamas both can exist in more or less in these people. They are having this balance of these problems. Um, some of the important things, yes, because we need to also conclude fast. Some of the diet, some things I will just touch on. Everybody has to be treated differently, so this is the classic statement I will any doctor will say. But in this case, definitely, because there is no common pathology in it. But what you can do is a lot of vegetables, fruits, vitamins, minerals, fibers, everything. Lot of plenty of sugar free liquids, um, and caffeine as minimum as possible. So when there is ayurvedic treatments, ayurvedic dietary support, this is very generalized. When there is vata disbalance very high, then we recommend warm, nourishing food like soups, stews, cooked vegetables. Avoid the cold, raw food and excessive caffeine, etc. And dry snacks, which increases the vata. Pitta imbalance, then cooling food like more sweet, sweet, bitter, and astringent. So bitter and astringent is like more like leafy green vegetables or those things. Dairy is coming under sweet characteristics. So sweet type of food. Avoid spicy, oily, and excessively hot food. Means too much spicy or sharp food, let's say. It's not only the warmth of the food, it is about the temperature. Not only the temperature of the food, it is about heat effect which happens in the body. For example, alcohol, it heats up the body, or the too much red meat, it increases the heat. Too much salty food, yes. Kapha imbalances, when there is a kapha is the predominant factor for in different conditions in CFS. We give light, warm food, dry food such as legumes, grains, pungent spices, etc. So here we will give more advice for sharp spices, more like chilies, cayenne peppers, or ginger powder, black pepper, these things. Whereas pitta and vata, pitta definitely bitter spices like cumin, coriander, fennel, um, rosmarins, or rosmarins, and all the peppermint, where these western spices we will say. Vata, we will give more spices like cumin, fennel, those antispasmodic things, which where it gives movement, peppermint, where there is a lot of menthol content, all the spices which has. General guidelines emphasize whole unprocessed food. This is very important. So unprocessed food. Favor well cooked meals. Stay hydrated with warm liquids. Individualized diet and lifestyle consultations. So another lifestyle recommendations. So next, so about the diet, this is the preliminary baseline advice. Regulated about lifestyle, regulated routine, adequate rest, gentle exercises, stress management. So these are the 4 points you need to focus on. Maintain a very this is what every time when I come for you come for consultation, make this um, routine, daily routine according to circadian rhythm. So this is like biorhythm you need to maintain so that you have energy levels. Adequate sleep. So try to prioritize quality sleep. Though you may not be sleeping, but still go to bed early and try to be as much as possible. Have a sleep hygiene and sleep night, how you call, mm, before bed routines. Yes, gentle exercises, non-strenuous. Incorporate the gentle and non-strenuous exercises like yoga, walking, improve the circulation and energy flow. So so yoga, this is very good for this new mind body connection, neuro, the muscular coordination, because it is very connecting the, this is mindful exercise. So any exercise can be mindful, even if you are lifting the weight. If you put the mind more into the movement, you can be mindful. But yoga is particularly mindful because, for example, if you need to stand in a one leg position in a kind of mountain pose, let's say, you cannot do it when you are thinking about something else. Yes. So walking and other exercises, also gentle exercises we say, which helps to improve the flow of energy. Stress management, I don't need to explain this. Meditation, deep breathing, mindfulness, emotional well managing this to improve the emotional well-being. Lifestyle recommendations continue. Workload balance, don't do too much, don't do too less. So this is the problem with many people, um, the typical pattern of CFS. They have they don't have good balance with workload. You need a incorporating breaks. Yes, mindfulness, mindful eating. You need to eat properly. Choose nourishing food, energy boosting food. Hydration is important. Connection with the nature is very important. So at least once in a week, I would say, you go out of the city, go to the woods, or be in the nature, absorb the energy in the nature. Digital detox, distractions as minimum as possible. So every distraction is stimulating the nervous system, making it more tired. So especially before bedtime, because your sleep will not be quality, the sleep quality will be disturbed. Social support, this is very important to have emotional well-being. So you need to have relations, you need to have connections, you need to have social network, family bonding, and I mean, at least reduce the isolation. So be with the friends, or however, reducing the isolation is very important. Some of the researchers says that mm, being in the with people, not being alone itself can is very neuroprotective. Like a child, a hug is very neuroprotective. A child who is with the mom, it is helping the growth of the brain. Somehow, this contact opposite to isolation. Isolation is very neurodegenerative, they say. This is the new researchers speak. So yes, mm, yeah. Some of the herbs, I would say ashwagandha. Ashwagandha, I mean, it's one of the herb which is commonly available, Vitamnia somnifera. Vitamnia somnifera. It's a very good adaptogen. Adaptogen means that which helps to help the body to adapt to stress and promote the balance. So it's not a, it's a modulator. So it gives a modulating effect on endocrine and also immune system. So it also has an immune modulation effect. Recent studies says stress reduction. It helps in reducing the fatigue. Yes, energy, to bit more energized. Ashwagandha is good. So don't take it in the night, but rather more in the after breakfast or in the morning time. Immune system modulation, it also is immunomodulatory, they say. So immune system dysregulation, it helps. Yes. Shatavari, this is asparagus racemosus. This is adaptogen, stress reducing, and immune modulating. Triphala. So the this herb is, so shatavari is something, okay, how ashwagandha is different from shatavari. Shatavari is more for females, but of course you cannot use it on too much if you have too much estrogen production, because it is also a phytoestrogen. So it can lead to development of nodes or breast nodes or any kind of growth. It can increase. So everything is having good and bad. You need to be careful. Triphala, this is where the digestive system involvement you can treat. So when there is inflammatory, digestive, antioxidant property, and anti-inflammatory property, all these things are there in this. So when the digestive system is involved, triphala is the best. So triphala is a three fruit combination. So it promotes the digestion, detoxification, and energy balance. So bacopa, Brahmi is something again cognitive, adaptogenic, antioxidant, and anti-inflammatory. So, but Brahmi is more calming effect. It has more calming effect than the um, ashwagandha. Ashwagandha is more energizing. Mm, so Guduchi is Tinospora cordifolia. So this is also very good for immune modulation. We give this for immune modulation, especially when there is autoimmune problems. We advise this skin problems with the chronic fatigue syndrome, with or bowel syndromes with inflammation, and also chronic fatigue syndrome. Some of the supplements, this I think is helpful. Multivitamins can help. Vitamin D, zinc, especially because during this season, magnesium, vitamin D, see, because these all things are involving in immunity, immune regulation. So when it can prevent the viral infections. These things can also help in neurological function, somehow nerves also it protects. So vitamin B12 is very much neural. It has a lot of energy production function and neurological function. So it is very important in case of vegetarian people. B12 and folic acid. Vitamin D, I don't need to explain. Immune system and bones. It's important for immunity. Omega 3. So this is good fats. All the different good fats for Vata people, especially fish oils, flaxseed oil, nuts, walnuts, and inflammatory properties it has. It is also very good if you use it in the diet. Coenzyme Q10. So this is new, a little bit new thing, which is helpful for improving the energy production. So CoQ10 I use sometimes, so it is helpful for improving the energy. People who has migraines, who has low energy, sometimes even POTS like orthostatic hypertension, means when they get up, people get up, they feel giddy, they feel tired, so they can also use it. Iron is very important, so when there is a deficiency, you must be taking care of this in the food or in the supplementation. Magnesium, so muscle, when it is connected more with the muscles, magnesium is important. Probiotics you can select for the digestive system, especially some gut flora probiotic, but nothing works if you don't eat enough vegetables, because prebiotic, that is fiber itself, is present only in vegetables. So if you eat probiotics, you eat also enough vegetables so that bacteria grows. Many times the problem in the gut is, it's not that you don't get enough bacteria through probiotic, it is bacteria doesn't have a proper environment to grow. So if you eat unhealthy, too much gap in between the meals, sugars, alcohol, these things grows the unhealthy bacteria, and it also changes the pH level, and then gut flora changes. So it's not, for example, yes, many of the infections of the stomach, H. pylori, or whether it is intestinal issues, it's more like balancing the pH, balancing the environment in the stomach is more important than antibiotic or anything which pushes the infective thing away, and or probiotic which in puts the new good things. So the environment has to be healthy, so good things will come inside and bad things will naturally go away. Adaptogens we told already, so all the lot of adaptogens we told, ashwagandha, rhodiola is also good. Rhodiola also gives a lot of similar effect in like ashwagandha. It helps to manage the stress and fatigue. N-acetylcysteine. So this is also glutathione precursors to glutathione, which is also a kind of antioxidant. So any oxidative process, infections or chronic autoimmune diseases, these things are a lot of producing a lot of free radicals. It breaks down many of the cellular elements, like I told you, these ribosomes and ATPs, these things, these production, and these things are being organelles are being getting destroyed by viral virobes, so viral things. So that's why antioxidants are very important. And other things, licorice is very good, especially in case of conditions where there is a kind of um, adrenal fatigue kind of situation. So we combine the licorice, glycyrrhiza, to these conditions. So like I said, there is a disruption in HPA axis. So in these conditions, when the stress, the response is adrenal fatigue, most of the time people say, so this is very helpful. Trikadu, Gugulu, Tulsi, mm, Amalaki. So a lot of things are there. Trikadu is for digestion. Black pepper. It's very simple. Long pepper, dry ginger, and black pepper. So three things together improves the digestion. So there are peppers. Comifora mugul. This is for the pain, metabolism. This is helpful. Tulsi is very good for stress, sleep also. Vitality, improves adaptogens. Amalaki has a lot of antioxidant properties and vitamin C. Um, a very important point is also that meditation and yoga part. I mean, you know these things. So we say mind is inside. Mind is like um, mind is like butter which is kept inside a kind of hot vessel. So the if the body is considered as a vessel, and the butter is considered as the mind. So when the vessel is hot, the thing, butter will melt. So that means that is a relationship between the mind and body. So you need to keep your mind also cool, or body also cool, so that mm, they maintain uh, they 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 maintain a harmony. So that's what, very interconnected and interdependent in these kind of diseases. Very much this understanding is very important. Practices like meditation, yoga, mindfulness. Yes, I had many things to say about this, but yoga, various yoga procedures, processes, some of them I will explain. restorative yoga nidra. So there is a particular guided meditation technique which they do in yoga. So they make you relaxed, very much deep rested, but still consciously deep rested. So mindful practices. So some of the exercise, the yoga process, these are simple things I have told. So mountain pose, you can just go look into it. So mindfulness, this is also very mindfulness. So this is just mountain pose. So not balancing yourself, improving the awareness, sense of grounding. Um, child pose is like, stretching yourself, bent knee, and hands forward. Cat and cow, bending forward, backwards on the knee, hands and knees. Um, Other things like Viparita Karani means like a spoon, opposite to. So put the leg up. This is like support of the wall. Without that, you can also support with your hands. You can lift your legs. So supported bridge pose. So you can also use some supportive thing before you use the bridge pose. So that is very good. And everybody's favorite shavasana means the corpse pose, like just lying down like a dead body. You don't need to be dead, but they say it is very good for deep relaxation. So modern yoga teachers, after they do all the intense exercises, make them to lie down in shavasana so that they find some time to breathe and relax. And of course, meditation, mindfulness meditations, various mindfulness meditations. So yeah, various things you can do. Focus on your breathing, focus on the sensations, five sense or sensations, what you feel on the touch, what the temperature you feel, what you okay, eyes are closed, then you cannot see. What you hear, the sound of the wind, for example. Yes, mindfulness can be done even in the movement while you are doing the movement, but benefit is very enormous. um yeah, various meditations, body scan, you lie down and you try to feel the body. Breath awareness, yoga nidra we described. Loving kindness meditation, so it's more like practitioners try to say things to improve your feeling of love and compassion towards oneself and others. So it's more like emotional well-being. Pranayama, this is also something you can practice, very simple things. Yes, diaphragmatic breathing. So yogic belly breathing, you say. So just to breathe, sit and lie down comfortably. Just inhale through your nose and allowing your belly to expand. So the stomach has to, the abdomen has to expand. Exhale slowly through the nose again or the mouth, drawing the belly in. So it's very simple. Belly breathing. So breathe through the belly. Alternate nostril breathing. It's also very simple. Breathe through one nostril, hold it, and then breathe out through the other. And then breathe one through this one, and then breathe out through the other. So there can be pauses in between, how much you can. So various breathing techniques like box breathing, square breathing, these modern things are there. It is like a more alternate nostril breathing itself with some pauses, so you could read about them also. So mantras, chanting, listening the music, this is also very helpful. Guided meditations, yes. So I conclude about the topic. I think we have taken 15 minutes more. Thanks for being here. And if you have any questions or queries, you could send me a message. If you have any in the email, yes. So I conclude. Thanks and have a good evening.